Okay, so let's make a start. And on this video, we'll have a look of first discuss a little bit about the urine, what's normal and what's abnormal to see in the urine. And then we'll discuss rest of the structures of the urinary system, including ureters, urinary bladder, and urethra. And I think that if we have time at the end, we'll also talk a little bit about the process known as micturition. So let's talk about urine. If we think of how much urine is made in one day, it's about 1 to 2 liters. So I think that converts to about a half a gallon. At this point, I want to remind us that the filtrate, which was what we saw inside the nephron earlier, is different from urine. Filtrate contains everything that blood plasma does except proteins. Whereas urine is what remains after the filtrate has lost most of its water, nutrients, and necessary ions through the process of reabsorption. Urine contains nitrogenous wastes and substances that are not needed in the body. So let's look at the urine. It is clear and pale to deep yellow in color. In fact, this yellow color is normal and due to the pigment urochrome resulting from the destruction of hemoglobin and solutes. Dilute urine is pale and straw-colored. Urine is sterile at the time of formation, and the scent of urine is slightly aromatic but starts to smell like ammonia over time. Urine is slightly acidic. The pH is around 6, but there is a large range of variation in this. And the specific gravity, which is one of the measures that we will potentially look at in our lab if we have time, that of a urine is from 1.001 to 1.035. So let's look at some of the things that we normally do see in urine. So we typically do see sodium and potassium ions. We would also see urea, which is the end product of protein breakdown. We would also see uric acid that results from the nucleic acid metabolism. And creatine that's associated with the creatine metabolism in muscles. It is also common to see ammonia and bicarbonate ions. Now, there are also things that we do not want to see in urine. These include, for example, glucose. High glucose would be indicative of diabetes, possibly. And we don't want to see elements from blood like red blood cells, their components like hemoglobin, and white blood cells. We also don't want to see bile in the urine. And I'm going to save the discussion about the difference between the terms pus and purulent to the classroom setting for the sake of time and also kind of managing that discussion a little bit more. But really all of these abnormal components and also normal components are dependent on how much and what kind of components we see. For example, seeing some glucose can be non-pathological if it is due to excessive intake of sugary foods, while it might be pathological in case of diabetes mellitus. So we really need to look more than just a single test to get to the root of understanding the patient's unique circumstances. And next I wanted to talk about ureters. These are about 25 to 30 centimeters long, so I think that's about 10 to 12 inches in length. They are slender tubes which connect kidney to the urinary bladder. These are continuous with the renal pelvis that we saw earlier on, and they run behind the peritoneum, so this connective tissue lining that surrounded the abdominal cavity. They help us to move urine, even against gravity, like you can see in this picture, by using this movement that we saw before, known as peristalsis. Now, let's talk about urinary bladder. Urinary bladder is a smooth, collapsible, muscular sac. It is situated posterior to the pubic symphysis, and it stores urine in a temporary manner. In males, the prostate surrounding the neck of the urinary bladder, and in females, urinary bladder is located anterior to the vagina and uterus. So I wanted to discuss about the three openings that we see at the base of the urinary bladder. These are our two ureters and one urethra. So the ureters are more posterior and urethra is more anterior. And if you draw an imaginary line between these openings, they form this triangular shape. And this is where this area gets its name as a trigone. And it's a really important anatomical landmark for us. And some of you might end up running into it if you go into medical imaging, for example. The wall of the urinary bladder is made of 3 layers of smooth muscle, which are collectively called detrusor muscle. We also see mucosa made of transitional epithelium. In an empty urinary bladder, these walls are thick and folded, but the urinary bladder can expand significantly without causing increased internal pressure within it. In fact, moderately full bladder holds about 500 milliliters of urine, and this is about 5 inches long, as seen in this picture, on kind of a more of a reddish color. But the bladder is capable of holding twice that amount of urine. So there's a lot of ability to expand, as we see kind of with the yellow region on this picture. Let's discuss urethra, which is a thin-walled tube that carries the urine from the urinary bladder to the outside of the body. And we will see 2 sets of sphincters here. First, the internal, which is involuntary sphincter made of smooth muscle, and then the external one, which is voluntary and made of skeletal muscle. I also wanted to talk about the sex differences. In males, we notice that the urethra is shared by both urinary and reproductive system, so it carries both urine and sperm. Whereas in females, this is solely dedicated to urinary system, so it carries only urine. It's also worthwhile to notice regarding the sex differences that in males, urethra is approximately 20 centimeters, so about 8 inches long, and travels through the prostate and penis. So we see these different regions like prostatic urethra, membranous urethra, and spongy urethra. In females, the urethra is about 3 to 4 centimeters in length, so I think that converts to about 1.5 inches. It's located anterior to the vaginal opening, and as a result, females are more prone to the UTIs, so urinary tract infections, as the distance for the pathogens to travel up the urethra is much shorter. And we'll see some of those examples in our final video for this chapter, where we'll talk about the pathologies. And now that we've talked about the ureters, urinary bladder, and urethra, I want to wrap up this video by briefly mentioning the process of micturition. So let's have a look at that. So the process called micturition, this is the act of voiding or emptying the urinary bladder. And like I mentioned earlier on, there are 2 sphincters that control the release of urine, and these were our internal and external urethral sphincters. Bladder can collect urine up to about 200 milliliters, and then the stretch receptors start to transmit impulses to the sacral region of the spinal cord. And these impulses travel back to the bladder via pelvic splenic nerves that cause the bladder contractions. And when these contractions become stronger, the urine is forced as the involuntary internal sphincter of the upper urethra starts to release. And as a result, we get this urge to void that we're feeling. And the external sphincter was voluntarily controlled, so micturition can be usually delayed until we are at the time and place where it is appropriate for us to urinate. So I think that about wraps up this video for us. In the next video, we'll talk briefly about disorders that relate to the urinary system. As always, thank you for joining me on this recording. Until next time, I'll see you there.